My name is Walid Nammour. I'm a Palestinian refugee. Originally I came from West Jerusalem, from an area called Katamon. But personally I was born in 1958 in the old city of Jerusalem. I was educated at De La Salle High School, a French school in the old city of Jerusalem for 13 years. After which I did my education both at Birgit University and then pursued higher education, college level, in France, in England, and ultimately I was a Fulbrighter at the George Washington University in the US, in DC, where I did healthcare and hospital management. I worked for about 30 years in town, in Palestine, in Gaza, on the West Bank, in Jerusalem, providing various supports in the area of health management and hospital administration. I taught health management at the three main universities in Palestine, at Bethlehem University, at Birgit University, and at Al-Quds University. I helped establish the School of Public Health at Al-Quds University and helped establish the physiotherapy department at Bethlehem University, among the things I have done in my life. You know, we never stop developing new ideas and new programs at Augusta Victoria Hospital. The most important of which during this last several months was the initiation and development of the bone marrow transplantation as an extended part of our hematology department. We have already done 3 fully successful bone marrow transplantation autologous, taking blood from the same patients and transplanting it again after heavy dose chemotherapy to these patients. And of a unique project that has been touching the hearts of all Palestinians, and we have made news even in the Middle East, which is a unique program, which is the opening of a school at Augusta Victoria Hospital for long-term patients who are here for longest time. So instead of getting children who have cancer or who come here for hemodialysis and playing on the internet, now they have the chance to pursue and to continue regular classes during their treatment plans, which can be extended into several months. We are doing this in close collaboration with the Palestinian Ministry of Education and Higher Education. One of the lead community programs at Augusta Victoria Hospital is the mammography and the mobile mammography. We have a car that goes all around the West Bank. It is currently in the southern part of the West Bank in Hebron. So the idea is for this to create awareness among women about the importance of testing and also about screening and diagnosing, and the unique component in our program is the short period of time that is normally where a woman can get diagnosed and be treated and followed up by a doctor within a week. And that is really very super in this part of the world, because in the past the time could have extended for 3 months. Now we know that a woman gets a mammography today, tomorrow her disc is passed on to our radiology department here, and if there is anything alarming, she's alerted within a few days of being, of having the test. Over the last 10 plus years, we at Augusta Victoria Hospital, because of the importance of non-communicable diseases, on top of which comes diabetes, and where we have very high rate of incidence, can reach up to 20%, where it is in America about 7%, in some parts like Denmark it's 5%, in Finland it's 7%, we have about 20%, although the official figures set the diabetes incidence rate at 14.5%, some experts believe it can reach up to 20%. So in order to build a model for the Palestinian Ministry of Health, we have equipped ourselves and tried to develop the capacity of all those concerned, including UNRWA, United Nations Relief Works and Agency, the Palestinian Ministry of Health, and other Palestinian key NGOs who are working in community health to develop their capacity in looking at diagnosing and creating awareness about a preventable disease, by having the right diet, the right nutrition, the right lifestyle, exercise. You can reduce substantially the incidence and prevalence rate of diabetes, particularly type 2 in Palestine. So we have our mobile clinic, but also central clinic that cares about food care, eye care, and about the diet needs of patients. So it's a real comprehensive community-based model in diabetes care. Because of our position here in the area of cancer care, we are a national cancer care referral center for all Palestinians. We are serving 4.5 million population who require radiation therapy. We are providing a comprehensive approach towards cancer care, including chemotherapy, radiation therapy, for all the hematology needs, including bone marrow transplantation, and now we're moving into palliative medicine. So our major strategic dimension for the future is develop our all-time vision of a palliative care institute here in Palestine to take care of the Palestinian population needs in the area of palliative medicine. We can only do this through the various support that we get from our supporters, from the Lutheran World Federation, from the Lutheran churches from around the world, from Canada, from America, from Europe. Your support here is essential, so we would like to continue this type of partnerships, all in the name of developmental goal and humanity at the end of the day.